If Doge was really smart, they would go straight to Medicare, Medicaid, and Social Security. This one is always a tricky situation because I can speak from the Italian perspective. We have Italian Social Security, which is 30% of taxes. 30% of taxes you pay in Italy go into Social Security. Even though we pay this much in taxes, the system is faulted and it's supposed to fail in 6 years. Meaning that young people are paying Social Security that they're expected to get when they get 60, 70 years old, but they will not get it because that thing has been managed so poorly that we are paying the pension of our grandparents, but not for ourselves. The problem is that if you cancel Social Security and these other things, you will have a lot of people without any of these programs. I believe that if you really want to get rid of stuff like Social Security that you know is a failing concept, because we have less people now paying for Social Security of older people, the government borrowed against it. You either have to slowly trim it down until you completely delete it in the next 20 years. So it means that you need more and more government on the same line of thought, doing it and completing this project. Or in the case of Medicare, Medicaid, except for one of them is for a specific niche that cannot be tackled in the way I'm going to describe now. To make public insurance cheaper, you need a healthier population. If you have a healthier population, you're going to use the healthcare system less, which means that the healthcare costs will be less of a burden. Which leads me to the next conversation. RFK. I don't know what these guys want to do. I have no idea what he wants to do. Being a person that can only watch, I'm just going to be watching and reporting what I see. It's not only him, it's also whoever will be after him. I think that whoever will be in power of health in America should be tackling your food industry, which means slashing a lot of profits for the food industry when it comes to processed foods. I believe that if you tackle food, you will have healthier people, which will lead to less use of the healthcare system, which will lead to lower healthcare costs. Why is that? Because America works under the concept of supply and demand. If you have an unhealthy population, you will have a high demand for healthcare system, which will be overly in demand with low supply, and so everything will be expensive. So yeah, can it be done? I mean, if you have left and right governments in the next 20 years aligned maybe on a general mission to make stuff cheaper and a healthier population, yes, you could do it, but highly in doubt about it. There's one thing that happens in America every single election is you guys are polarized as hell. I believe that if you voted the same side for the past 30 years, you are the problem. I think that everybody should be in the middle and then choose accordingly every single election, do a little bit of studies. Until this is not taught to Americans, guys, you will be always in two separate factions, divided as hell, and no long-term concept will be, let's say, brought on by governments. Because you're always going to have a government that scraps everything that the old government did and starts from scratch, not giving enough time for reforms to do things.